I'm going to talk to you about is really doing a bit of a personal reflection around whether researchers are equipped to communicate their research. And it's really reflecting on some of my own journeys and what I've been busy with. So I'm a health researcher. I work at the university where I head up the Center of Evidence-Based Healthcare, and I also work with the International Cochrane Collaboration. And we also work with various grants that specifically support activities to promote the use of evidence in decision making. Now, we've been talking a lot about evidence-informed decision making, evidence-based decision making, and I thought it's just important to just pause for a moment and reflect on what it means. And I think one of the key things if we're talking about healthcare decision making is that there's various factors that influences that healthcare decision. You can think of your own personal journey or that of your family, or if you're taking care of others and managing others in terms of healthcare. It's influenced by the burden of disease, and we have various diseases, infectious diseases, chronic diseases, diabetes, hypertension, obesity, and the list goes on and on. But then we live in a country with resource constraints, and we need to deal with what we have available in terms of human resources and also in terms of other financial resources and drug resources. If we're talking about healthcare, there's various levels of care. Is it private sector? Is it public sector? Is it primary care? Is it tertiary hospital level care? But then importantly, if we come to the patient or the recipients of the care, it's also about the acceptability of the care that's being offered to them, and their own values and preferences related to what works and what don't work. In terms of the preferences and values, it also speaks to the healthcare providers and their own experience and what they have learned and seen what has worked over time. And then, of course, there's politics with a big capital P. And amidst all of that, we want to use best evidence. Now, if we talk about evidence-informed decision-making, it's where we want to use evidence, and we use evidence in an explicit way to be part of our decision-making process, where it is a necessary but often not sufficient element of healthcare decision-making. Okay? So it's an important part, and as Jimmy's put it this morning, very succinctly, evidence matters. So if we talk about evidence-informed practices, we want research evidence to be part of it. I quite like this diagram from the support collaboration that mainly work towards evidence-informed health policy making. But importantly, you can see it starts right on top by drawing on research evidence, systematic reviews around whether something works or not, and then importantly drawing on further local evidence around values and needs and costs and all those other factors. And that comes together to be able to make a judgment around benefits and harms and what works, and ultimately leading into well-informed health policy decisions. So this is the same that we want to do in terms of our own personal decision-making also, to be able to make evidence-informed decisions. So if we're talking about this field of evidence-informed healthcare or evidence-informed practices more broadly, beyond the health field, who are all the role players who play a role in if we focus on evidence-informed healthcare decision-making? And there's quite a long list. I put right on top the policymakers who make healthcare policies and develop guidelines, the healthcare managers at various health facilities. There's all the various healthcare workers and health practitioners. There's the researchers as those who generate the research evidence. There's the public and the consumers of healthcare, so the patients, their family members, the informal carers, and there's the media. And my talk is initially going to be focusing on so what's the role of researchers to communicate their research, and that's why I've put researchers in bold in this particular presentation. So I'm really reflecting on my own experience, and I think the first thing that I want to point out is that on this research road to develop and deliver robust research, because that's what we want to expect from researchers, that where research is being done, it will be delivered and it will be good quality research. So it needs a good question, it needs robust methods that minimize bias and imprecision, it needs to be ethically sound, it needs to have a sound investigator team that can actually deliver on the research, it needs to have a protocol or a recipe of how the research will be done, typically the protocols needs to be reviewed and ethics needs to be approved. And what we see nowadays is that more and more protocols are being published as another mechanism for transparency. When the researchers report their findings, they should avoid selective reporting of research. And importantly, they need to consider the totality of the evidence, meaning all of the evidence. So they need to look at systematic reviews of the literature to see how does their research that they found, how does it fit into this existing body of research? And then they need to disseminate their findings. So that's quite a tall order. That's a lot that needs to happen. And it doesn't take a few weeks. It often takes a few months and sometimes years to produce the research products. So how do researchers communicate their findings? Typically, they'll submit their research to a peer-reviewed journal. And there's been a lot of talk today about peer-reviewed journals. But the ultimate aim is to submit it to a good journal where there will be peer review and it will be published. And researchers will go to conferences and present their findings there. So the question then is, what do they do to promote the use of research evidence beyond journals? And what do you think researchers do to go beyond journals? Can I have a show of hands? How many people think researchers do anything to go beyond journals? Okay, so there's a few that says there's at least something that's happening. It looks like most people think there's nothing that's happening to communicate beyond journals. And I think you may not be far off to think that not much of it is actually happening. If we think of communication with the media, these are some quotes that people mentioned yesterday. So you may spot yourself having said this. Some people said scientists are bland. They've got no media training. They put out stories with no human element. Or from the media side, they can't comprehend the press release. And someone said, we get you into trouble all the time because we misquote you all the time. Okay? So those are the kind of things that was put forward yesterday about researchers. And I think it's not unfounded, because if you consider how do researchers get trained, and I thought which program will I put up here, and I thought seeing that I'm doing personal reflection, I should put up a master's program that I myself is involved in, where we're training clinical researchers. And the typical curriculum doesn't cover communication of research beyond publication. The curriculum covers epidemiology, biostatistics, research methods, doing your systematic reviews, how to review papers and critically appraise existing research, randomized controlled trials and diagnosis and screening. So it's covering the methods to be able to do research well and to complete that journey along the research road. But it doesn't really take researchers beyond the publication of research to other forms of communication, which is then no surprise when researchers are being asked to communicate with journals that they are completely unsure or totally scared, fearing misrepresentation and sensationalist reporting. So if we now think a little bit around, so what can be done to build capacity of researchers? And my approach that I'm putting forward that we need to consider is that there needs to be activities at a researcher level. So what capacity can be developed at a researcher level? We then need to think of the research institution or the academic institution within which that researcher functions. And then importance, we need to consider the broader context of communication and science communication to the public. So starting with the researcher, I think one of the key things to start with is to move beyond the typical curriculum to get research done well, to include aspects of communicating research, to build the skills and the knowledge of researchers to be able to think through communication approaches, and to start increasing the practice and actually doing of further communication strategies and implementing those. So one example is a course that we've actually started with this year, and we're busy building it up into a formal module, I must add, that will be incorporated into our master's postgraduate program, which is around the art and science and complexity of knowledge translation, which is this whole field of getting evidence into decision making. And in this workshop at the moment, what we're running this year, is around focusing on researchers and getting them to think through a communication strategy for their own research. Who do they want to communicate with? How do they think they can do it? What's their plans for implementation? And actually helping them to come up with a communication plan that moves beyond publication of their research and just presentation at a conference that speaks to other researchers. But I think it's not about the researchers on their own to be able to do this. So one of the other important things is the engagement with journalists. And somebody yesterday said it's a two-way thing. So I want to use an example of where we've been working with policymakers. So it's a different type of stakeholder, but we've been working with policymakers, health policymakers, to increase the use of research evidence in policies. And as part of that process, we've done an evaluation, and this one quote really speaks to this whole engagement. The quote, and I'll read for you: "We don't have their capacity or skills, and they don't have ours. The linkage is key to making the process smoother." And that was a quote from some of the researchers that we linked with policymakers. So what did we do in this particular project? We implemented a buddying model, an informal linking model, where we linked one-on-one a researcher with a provincial policymaker. And the whole purpose for that linkage was for them to increase their dialogue through having coffee together, through having a phone call, through having a face-to-face meeting around a particular policy issue that the policymaker was grappling with the whole idea that the policymakers will learn more about the researcher world, the researchers will learn more about the policymaker world, and that they will start having further engagements and increasing the demand for evidence. And one of the key things were that through working together, there was some trust that developed, and importantly also understanding of each other's environments. Now if we move to the research institution, I think one of the important aspects is that research institutions such as academic institutions within which we operate, or the Human Science Research Council or medical research councils, for example, need to provide a supporting and enabling environment for science communication. And I think one of the examples from our faculty is actually having in-house science communicators who works with the researchers to communicate findings of research. So we, for instance, have an in-house marketing and communications office which supports the communication of research findings. Similarly, for instance, at the Medical Research Council, there's also a corporate and marketing communications office. So these kind of strategies are strategies that research institutions can use to advance science communication. But then I think importantly, beyond all of that, there's the broader context within which we function for science communication. And I think my question would be, currently, is there a requirement that science communication needs to be informed by best evidence? And is research evidence a necessary part of that whole process? If we draw parallels with what's happening in the field of clinical guidelines, nowadays, for instance, the World Health Organizations don't put out any guidelines that's been informed by systematic reviews. So there's actually a rigorous assessment of those guidelines to see whether the guidelines were informed by research evidence. I know it's different worlds, but I think it's an important area that needs to be considered. And I want to quote Sir Ian Chalmers, who says, "We will serve the public more responsibly and ethically when research designed to reduce the likelihood that we'll be misled by bias and the players of chance will become an expected element of professional and policy-making practice and not an optional add-on." So in summary, I think in terms of building capacity, or do researchers have the capacity at the moment for science communication, my answer would be no, most don't, unless they have a natural affinity for doing that and an interest for doing it. I think it's important that this capacity needs to be enhanced, but that capacity is not just about at the individual researcher level, it's also about building capacity within research institutions, And it's also about creating a change in the context of science communication and communication to the public. And most importantly, I think it's important to create and foster partnerships. So I want to conclude with a quote from Mother Teresa, and she said, "I can do things you cannot. You can do things I cannot. Together we can do great things." Thank you.